This summer's bushfires have seen large parts of Australia, including our major cities, blanketed in smoke, with doctors calling it a public health emergency. While recent rainfall may have given us a bit of a reprieve, what damage has been done and what can we do differently next time?
Australia is not only smoking, it's choking.
We can't breathe. Nobody can breathe.
It's one of the rare times you can barely tell the difference between Sydney and Melbourne's skyline. The haze has settled over Canberra too, and there's no shortage of people suffering.
I think people don't really understand how severe asthma can get.
Not even the fittest amongst us can handle it. Major sporting events have been cancelled, and it's feared tennis players at the Australian Open could be impacted.
These fires are unprecedented. Never before have we been exposed to the intensity and duration of smoke, such as that which we're experiencing.
On any given day in many of our capital cities, this is what we're breathing in. Tiny but toxic dust particles that penetrate deep into our airways, choking our lungs and making it difficult to breathe. It's taking a toll on aged care nurse Dominique Ringwet.
It's very, very difficult on us. I've seen my son worry if I'm okay. When I'm going to sleep at night. The moment I start to cough and he'll walk in, I'm sitting up, I can't breathe.
This single mother would normally spend her days caring for others. But like so many Australians, this unbearable smoke has affected her asthma so badly she's now a prisoner in her own home, forced to use her sick leave to take care of herself.
I had to be taken to hospital a few times, not knowing if you'll wake up from an asthma attack at night. Can't afford an ambulance. It's too much. No healthcare card to help you there.
Okay, so this is one of your puffers.
That's one of them.
How often do you have to use this?
This is a Pomacort Epihaler. This was 2 puffs morning, 2 puffs at night, but now I have to increase dosed, so that's 4 times a day at 2 puffs each.
So that's double the dose?
Yes, it's double the dose, so the cost of replacing it is it's quite high.
This bushfire crisis has us breathing in the worst air quality in the world right now. Sydney, Melbourne and Canberra recording pollution levels 15 to 25 times higher than levels deemed hazardous. Major cities like Beijing and New Delhi that are 4 times the size are less polluted today.
We are turning into a third world country.
Step outside, breathe in this dirty air. It's equivalent to smoking a pack of 50 cigarettes. Images of our smoke haze have been spotted by NASA as far away as New Zealand and even reaching parts of South America. Experts suggest it's expected to make at least one full circle around the globe before returning to wreak more havoc on Australia.
The nurse actually said that I was one of the worst cases of asthma attack that they'd seen since the smoke said. Come on.
Canberra Uni student Eloise Robertson has been suffering from debilitating daily asthma attacks.
The first night I was in intensive care, the smoke was so bad that it actually set off the fire alarms. So here I was in hospital on oxygen and the fire alarm went off.
Asthma Australia says months of dangerous air quality has already claimed 3 lives. Among them, 19-year-old asthmatic Courtney Partridge McLennan. This heartbreaking statement from her family in New South Wales. Our lives changed forever. Our hope is that greater consideration is given to air quality monitoring and reporting, as well as accurate representation of the far-spread, catastrophic health impacts our nation's bushfire crisis is really having. In most states, air quality levels are only measured over a 24-hour average. Real-time readings are not available in New South Wales, Canberra, Queensland, the Northern Territory or Western Australia. Michelle Goldman is from Asthma Australia.
It's
critical we provide a reliable tool so that they can make important decisions. Are conditions fair, in which case I can go about daily activities, or are they poor or hazardous, in which case I need to bunker down.
Professor Gordian Fulda is a director of emergency medicine and says the reason why this smoke is so deadly is because Australia has the highest rate of asthma in the world.
Asthmatics, if they get to an emergency department, very, very, very rarely die. I can nearly give you a guarantee if you come early, you'll survive, whereas if you stay at home, could turn out bad.
There's so many different masks available at the moment. What types are actually effective?
What's really important to know, these type of masks, that hospital or surgical masks, are useless at preventing smoke getting into your lungs. What we need is a good fit, covers your whole face and seals onto your face so that no air escapes around the corners. This is called P2, filters out all the carbonaceous material. It is highly effective and very, very good. These are more convenient. It can be kept in your bag, pocket or whatever, but same principle. It fits over your face and tightly.
So someone who's a severe asthmatic, can they buy one of these?
Oh, absolutely.
And you'd recommend that for them?
Very highly, because it's all about prevention. You know, you should have these masks because we're going to have really bad days.
Parts of Australia have been burning for months. This thick, stifling smoke haze has become the new norm, the new air that we breathe. With a long, hot summer ahead, experts are worried about the future and the long-term impacts for us all.
Help us to breathe easy again. Please help us, because this isn't right on us, not fair on our children to worry.
You can pick up most of those masks there for under $5. And for more details on where to buy them, just head to our homepage.